Hi, I'm Robyn Matlon, a psychologist specializing in psychological and neuropsychological evaluations at the Center for Children and Youth. Today's parenting tip discusses the overlap of symptoms in ADHD and anxiety and the importance of an accurate diagnosis in determining how to best support your struggling child. While we're spending more time at home and children are learning at a distance, you may have questions about new behaviors that you're seeing. Understanding whether it's ADHD, anxiety, or both is the first and most important step in making sure that your little one gets appropriate support, as they each require different types of support to improve. Anxiety and ADHD are very different, but the symptoms can sometimes look similar because both are driven by changes in the prefrontal cortex. The processes behind these changes are different, though. With anxiety, intense and persistent symptoms are brought about by the fight or flight response, even when there's no threat. With ADHD, the symptoms are brought about by structural, functional, and chemical changes in the brain. When there are changes in activity in the prefrontal cortex, as with ADHD and anxiety, your child may not be able to pay attention, seems distracted, acts hyper, or may have a difficult time controlling emotions, impulses, and behavior. ADHD is often treated with medications that boost neurochemicals and stimulates the parts of the brain that are needed to work a little harder. This may be effective for ADHD, but if the symptoms are being driven by anxiety, the use of ADHD medication can be detrimental and fails to give the child the skills that are needed. Even if anxiety and ADHD are happening together, it's important to treat the anxiety as a separate condition. In these cases, individual therapy and parent coaching are critical components of treatment. If you suspect ADHD, it's really important to get a comprehensive assessment from a licensed psychologist or neuropsychologist. Many of the symptoms we discussed often point louder to ADHD than anxiety, so purely going off a pediatrician's ADHD checklist could lead to misdiagnosis. In some instances, it may be that both anxiety and ADHD are driving behavior. Regardless, getting an accurate diagnosis is the most important step in getting your child the support they need to better regulate and thrive. Please reach out to our professional staff if you'd like to consult and determine if your child might benefit from a comprehensive assessment or any of our individual and family therapy services. We're here for you.